How do we maintain the cold chain for the COVID-19 vaccine distribution? My guest today is Jason Burns. He is Director of Corporate Development with Dropoff and First Vice President of the Customized Logistics and Delivery Association. Hello, Jason. How you doing?
Bob, I'm doing well. Thanks for having me. Glad to be here with you today.
So what is the biggest logistics challenge of maintaining a cold chain for delivery of the COVID-19 vaccine?
Well, I think there's a few different challenges relative to the vaccine being distributed to 100 million plus Americans in a 5 to 6 month time frame. I could just kind of highlight, obviously, from a cold chain standpoint, we have to maintain the temperature environment of the vaccine. There are a couple different types of vaccines that we know that one's been obviously released this week. The Pfizer one that has some extreme temperature environment that needs to be maintained -94 degrees. And then you have the Moderna and potentially the AstraZeneca vaccine, which is going to be more of a refrigerated environment. And so both environments require some nuance and some different handling procedures you need to have in place. But mostly what we think is going to happen from a last mile delivery standpoint, where our members will come into play, is going to be on the refrigerated vaccine. It looks, from what we've seen this week, UPS, FedEx, they're going to be doing more of a point-to-point distribution model for the Pfizer vaccine because of the extreme temperature environment needs to be maintained. Then Pfizer's obviously made their own kit to transport that vaccine, and then when it gets to the vaccination site, hospital, clinic, doctor's office, etc., it needs to still be maintained there. So I think adding dry ice to it is probably going to be the way they maintain it, unless some of the larger hospital systems have the equipment, freezers necessary to hold at that temperature environment.
Well, do they? I mean, have previous vaccines required that same severe temperature control that the Pfizer vaccine requires?
Not to my knowledge. Again, I'm not an expert on all the vaccines out there, but I've from a logistical standpoint, I have yet to come across or experience any type of distribution where the environment needs to be at that range. And so it does present a number of inherent challenges with it. Even once it's delivered to the site, my understanding is that the actual case that it's secured in can only be opened a couple of times a day for a couple of minutes at a time. And so there's just a whole host of logistical issues through the supply chain, and actually when you're administering the vaccine, that need to be need to be accounted for. So, I think where we come into play is more for the Modernas, the AstraZenecas. Those are going to be distributed in more of a traditional model through McKesson, which really we do a lot of that work today. We deliver a lot of refrigerated type vaccines today. Typically, those vaccines arrive at our receiving facilities, our loading docks, already prepackaged in a refrigerated, whether it's a tote or whether it could be some type of insulated packaging, where most often we don't have to add anything to it. When I say anything, dry ice or cool packs. However, there are times when we do have to get more involved in terms of the handling to make sure that temperature environment is maintained. And so we have a lot of experience doing that. The industry does, and certainly our company does. And we also have additional tools that we use in terms of sensors that allow us to get visibility, so we can proactively see what the temperature environment is. We can set ranges on these sensors.
Right, but you're saying, I just want to get this clear. You're talking now about what you would be handling would be the AstraZeneca, the Moderna, whatever it is it doesn't require that severe, super cold, just refrigeration.
That's correct.
But who's going to handle the Pfizer one? Are you saying that UPS and FedEx has the capability to do that? Who can handle that safely?
Yeah, so what we've seen this week so far is UPS and FedEx are currently seem to be the two primary carriers that are transporting that vaccine across the country. And I think from what Pfizer, the way they've packaged it is Pfizer's really built a special kit that will maintain the temperature environment um, during the duration of the supply chain,
Hmm.
during transport, and then once it gets to the vaccination site, my understanding is again that then at that point they will need to continue to add dry ice to that kit
I
so
see.
that
But
it can continue to maintain
the
it.
kit has to be refrigerated, but the interior of the trucks don't necessarily have to be. It can just be
That-
regular trucks.
That's correct.
Okay, so you
That's
don't
my
need a big
understanding.
infrastructure of trucks with chill capability. What about storage facilities like warehouses and the like? Is it the same thing? They themselves don't have to be cold, just the containers, the sealed containers have to be cold. Is that right?
Yes, yes.
I see.
Unless you're dealing with and typically you probably won't find this in too many places, but there are some select hospitals, more regional hospitals that may have a freezer that can go to
Hmm.
a negative 94 degree temperature
Right.
environment in which you can transport the vaccine into that
Well,
storage unit.
okay. So this all sounds like you can do it on a fairly small basis, but we're talking about an initial shipment of 20 to 25 million doses and eventually 300 to 350 million doses throughout all next year. And then, of course, globally, even more than that. Does the infrastructure exist to handle vaccine delivery at that scale?
Assuming the manufacturers of the vaccine can pre-package it, yes, it does
Yes.
exist.
Okay.
Yes, I think it exists. Now, I certainly believe that we're going to have to continue to build up the infrastructure because certainly just with the sheer volume, as you mentioned,
Hmm.
and again, it's not just phase one, two, and three that we've all heard about. It's going to be continued. That the vaccine is going to have to continue to be administered and disseminated throughout the country for many years. So I believe the infrastructure exists. I do believe that there are some challenges, particularly now that we are in peak season from an e-commerce delivery standpoint. So supply chains are already at capacity. UPS and FedEx have notified some of their shippers they're capping the volume this year so
Yeah.
they can make room for the vaccine.
Hmm.
So it exists, but I think we're going to have to continue to increase and add more resources to handle that continued volume.
And do you think that throughout next year, as UPS and FedEx and yourself and whoever is dedicated to handling and delivering this vaccine, is that going to take up so many resources that it's going to take resources away from normal shipments that there won't be enough capacity and delivery capability for everything else? Is that a possibility?
Very much so. Very much so. It's going to be real interesting to see. We'll get our first taste of that now during peak season. So I think capacity is the major challenge I see right now
Mhm.
over the next 3 to 6 months with the vaccine, kind of hitting the first few phases. Um, but the one silver lining here is that because of the pandemic, there's been an increase already since probably March on e-commerce shipments. So from a carrier standpoint, I do think there's some leveling out of what peak season would normally be a 20-30% increase over the normal volume for the year. So I do think
Mhm.
there's that capacity's been built a little bit already. But yes, I think we'll have to continue to work on that.
Do you see any issues with regard to urban versus rural delivery, like different parts of the country with different requirements, distances, capabilities? Is one of those situations going to be more difficult than the other in terms of getting the vaccine delivered?
Yeah, certainly, rural environments are always more challenging when you talk about logistics, whether it's a vaccine or whether it's your kid's Christmas toy.
Hmm.
Um, obviously, from a carrier standpoint, density is king. So where we can find density at in mostly urban settings, it's more economical and it's more efficient. So certainly, the rural areas will need to probably have a different plan. You're probably gonna be looking to add that capacity there before the urban areas to better support them.
Hmm.
Um, but our industry has always been very resilient and responsive, and we always seem to rise to the challenge. So I'm sure over time we will get better at this.
Okay, so overall, you seem to have a positive expectation of our ability to deliver this vaccine throughout next year, despite the challenges that are going to arise, right?
I do, and I also think that again after the first kind of phase, the first wave of the vaccine. Um, we're probably, we're starting to see already, with e-commerce, the same trends of e-commerce, I think are you're seeing parallels in healthcare. So, patients are no longer going to the doctor's office. They're staying home, and maybe the doctor's visiting them, or they're getting their pharmaceuticals delivered to their home. So I think from a last mile perspective, we will certainly start to play more of a major role as the vaccine gets into these markets, and then we take it from a local city into a residential neighborhood.
Mm-hmm. Okay. Well, it's going to be interesting to see how this plays out. But Jason Burns, thanks very much for helping us understand what the challenge is, and maybe even giving us a little bit of a positive message about how we're going to be able to overcome it as we get this vaccine out to everybody. Thanks very much for being with me today. I really appreciate it.
Well, thank you so much. Pleasure's all mine.